Next component in common blood investigations is lipid panel. And when should we check lipid profile? In case of suspected cardiovascular disease, coronary artery disease, peripheral vascular disease, patients with diabetes mellitus at least should check once in 6 months, and patients with thyroid, liver or renal disease should check lipid profile because the lipid metabolism may be altered. Individuals above 40 years should be checked for lipid profile once in a year. How the sample is taken to check the plasma lipid profile. Sample of serum should be taken after 12 to 14 hours of fasting, and normally the lipid profile is assessed by estimating the fractions in plasma, which are total cholesterol, HDL, LDL and triglycerides. So what is the normal range of total cholesterol level? It varies from 140 to 200 mg per dl. Individuals with any other risk factors, the level should be maintained below 180. Around 220 mg per dl is considered as moderate risk, whereas above 240 mg per dl needs active treatment. So what are the major sites of synthesis of cholesterol? It is synthesized in liver, adrenal cortex, testis, ovary and intestine. And the functions are: in cell membrane, the cholesterol is a component of cell membrane and it has effect on the fluid state of the membrane. It maintains the fluid state of the cell membranes. In nerve conduction, the cholesterol has the insulating effect on nerve fibers. Bile acids and bile salts, they are derived from cholesterol. Steroid hormones such as glucocorticoids, androgens and estrogens are from cholesterol. Vitamin D3 is from dehydrocholesterol. Clinical conditions in which the serum cholesterol level is high or diabetes mellitus, obstructive jaundice, hypothyroidism, nephrotic syndrome, familial hyperlipoproteinemias. LDL, the National Cholesterol Education Program, they identified increased LDL as a prime risk factor for coronary heart disease. So blood levels under 130 mg per dl are desirable. The levels between 130 to 159 is considered as borderline, while above 160 it carried definite risk. LDL helps in the transportation of cholesterol from liver to peripheral tissues, and only apoprotein present is ApoB100. What are the clinical correlations with LDL? So the LDL concentration has positive correlations with incidence of coronary vascular disease. What is the pathogenesis? This LDL infiltrates through the arterial walls, which are taken up by the scavenger cells, that is macrophages. And this is the starting event of atherosclerosis, leading to myocardial infarction. Since LDL gets deposited in the tissues, it is considered as bad cholesterol. LDL in common parlance is defined as lethally dangerous lipoprotein. Especially the oxidized and glycated LDL creates a procoagulant surface on the endothelium, and this procoagulant surface causes the blood clot formation. And this oxidized LDL is found in higher levels in cigarette smokers, patients with diabetes mellitus, and any other cause of insulin resistance. And what is the normal level of HDL? HDL above 60 mg per dl protects against heart disease, and level below 40 mg per dl increases the risk of coronary artery disease. For every 1 mg per dl drop in HDL, the risk of heart disease rises by 3%. And what are the clinical significance of HDL? The level of HDL in serum is inversely proportional to the incidence of myocardial infarction, unlike LDL. And as it is anti-atherogenic and protective in nature, it is considered as good cholesterol, and the H in HDL can be remembered as healthy. And what is the normal serum triglyceride levels? It ranges from 50 to 150 mg per dl. Blood level more than 150 is injurious to health. Almost 90% of coronary artery disease is predictable, preventable, and curable only with little lifestyle changes, which includes regular exercise, balanced diet, cessation of smoking, weight control, control of hypertension, diabetes, and dyslipidemia. And now the aim is to reduce total cholesterol level below 180 mg per dl, LDL level below 130 mg per dl, whereas HDL should be maintained above 35 mg per dl. So first and foremost is to reduce the dietary cholesterol. Cholesterol in diet should be kept less than 200 mg per dl per day. Should know eggs and meat contains high cholesterol. One egg yolk normally contains 500 mg of cholesterol. So when we consume 2 full eggs, it increases the blood cholesterol by 15 mg more than normal required level. Next, vegetable oils and PUFA. Vegetable oils like sunflower oil and fish oils are rich in PUFA. They are required for esterification and final excretion of cholesterol. So the recommended daily allowance is to take 20 to 25 grams of oils and 2 to 3 grams of polyunsaturated fatty acid. Also remember, PUFA in excess may be harmful. Number 3 is green leafy vegetables. Due to increased fiber content, they increase the bowel mobility, which decreases the absorption of bile salts and which causes decreased absorption of cholesterol. The most important modifiable risk factor for coronary artery disease is mainly the sucrose and cigarettes. About exercise, regular moderate exercise, that is at least 30 minutes per day, decreases LDL and increases HDL. Individuals who walk less than 1.5 kilometer per day, they have 2.6 times greater risk for coronary heart disease death and 2.4 times greater risk for cancers. And finally, what are the hypolipidemic drugs used to control the cholesterol level? It is HMG-CoA reductase inhibitors. Those are statin drugs, and the popular ones are atorvastatin, simvastatin. They are much effective in reduce the cholesterol level. And bile acid binding resins, namely cholestyramine and cholestyramine, decreases the reabsorption of bile acids. Probucol increases LDL catabolism, so more cholesterol is converted into bile acids, thus decreases the cholesterol level. And the nicotinic acid, it inhibits the lipolysis, which reduces the plasma cholesterol level. Thank you.